Thank you, Commissioner. Those are really great words and encouragement for us to really work hard today and listen attentively. So last year, our prior representative, where I live in Stoneham and Winchester, decided, I think, to retire from the legislature. And my wife Deborah is here. We're interested in legislative activities, but I don't think either of us had been that involved before. But fortunately, Deborah began looking into who was looking in the running, and she came across Jason Lewis, who is here today, Representative Jason Lewis. And Jason won his race and is now in the legislature as of January 2009. So we're thrilled because we believe Jason has the values that really support, I think, the community approach to helping people, and he has a reform approach. He really, I think, from what I've seen and read, is interested in changing not only what's happening on the Hill to a degree, but also what's really happening to people in the community, which I think is where people should really be focused. Since taking office, Jason's been very active in filing reform legislation in relation to the economy, ethics, and healthcare. And I'm quoting Jason from an article I read here. Jason said, "Access to healthcare must be universal. Healthcare should be viewed as a basic human right, not as a luxury that only some people can afford." So I have no doubt that we will be hearing from Jason, not only right now, but in the near future. So with that, I'm grateful for Jason, and Jason's going to offer some advice.
Thanks, John. I appreciate the kind introduction. It's a pleasure to be with all of you this morning for this summit on such an important topic. And like you, I'm looking forward to learning more about cutting-edge research in the field of mental health. I'd like to start by recognizing and by congratulating John. John is one of only 10 recipients nationwide of a Robert Wood Johnson Foundation Community Health Leader Award, as some of you I'm sure already know. And it's my understanding that this summit today is funded, at least in part, from this grant. So again, I would like to make sure we all recognize John's efforts and contributions. I'm particularly pleased to see the Department of Mental Health co-sponsoring this event with CQI. I commend Commissioner Lidholm and her team of dedicated staff members. It's great to see our state government working hand in hand with community groups like CQI to better serve our citizens with mental health conditions. As John mentioned, I was just recently elected to our state legislature, and it's actually my first time ever serving in elected office, I guess since high school student council, and that was some time ago. And one of the things that really motivated me to seek public office was the opportunity to be in the forefront on a range of important public policy issues. And for me, none more so than healthcare. With healthcare reform now being hotly debated, as we all know, in Washington, many people are looking at Massachusetts as a model for how to fix our broken healthcare system on a national level. In addition to the landmark Healthcare Reform Act of 2006, Massachusetts, as I'm sure you know, has also taken strong steps in recent years to address mental health needs. During the 2005-2006 legislative session, a new joint committee on mental health and substance abuse was formed. This was a strong statement by the legislature of the importance and of the high priority of addressing mental health and substance abuse issues. Then in the last session of the legislature, two major pieces of mental health legislation were enacted. An act relative to mental health parity mandated that health insurance plans cover all mental health disorders, including substance abuse, eating disorders, and others that were previously excluded. And second, an act relative to children's mental health, expanded efforts for the early identification and treatment of children's mental health needs. Passing just one of these bills during the legislative session would have been impressive. Passing both was a major accomplishment, and I think speaks to the commitment that our legislature and our governor have to mental health.